All right, let's remind you of that question we're asking you for the day, and this question leads up to our next conversation. We're asking you, Health Minister Dr. Zweli Mkhize says he is concerned about the increasing allegations of healthcare workers contracting COVID-19, and we're asking you what more needs to be done to ensure that healthcare workers are protected. I see there's already quite a lot of traffic in terms of responses to that question of the day, and we're going to look at your tweets at some point. But to this now, 5% of healthcare workers have been infected with COVID-19, translating into 24,104 as of the 2nd of August. This came out in an address by Health Minister Dr. Zweli Mkhize earlier this morning, where he was giving an update of the country's fight against COVID-19. In it, he also thanked health workers, specifically for the work they do in this effort. But healthcare workers are living in constant fear of infections as they watch day after day colleagues succumb to this pandemic. The South African Medical Association trade union, Samatu, is calling on government to prioritize this sector. We're joined now on the line by Dr. Mpopoe. A very good morning to you, Dr. Mpopoe, and thank you so much for making the time. I don't know if you were listening on the minister's briefing. He touched on the increasing number of healthcare workers dying in the line of duty and the poor quality of PPEs. Are these the things that Samatu has been talking about? Is acknowledgement enough, or do you want government to do more?
Thank you, Desiree and the team. It is true that we are losing more health workers every day. We have reached a stage of conflict. Conflict in a sense that we say to save or to save oneself. We're working in an environment which is very risky, not risky only to health workers, risky to our families too. We've been crying about lack of PPEs since the first day that we had this pandemic in the country, since we had the first cases in KZN. But it seems like this is falling on deaf ears. It's just talk by the senior people, by the government, and nothing much is done. Only last week, I can give you sad statistics of last week. Between Thursday and Saturday last week, we lost 7 doctors. And I'm talking about Gauteng only. Those 7 doctors are from Gauteng. Those are fathers, those are mothers, daughters, sons of the community. We are held, strangulated by the Hippocratic oath that we have taken. We want to help, but how do we help when we cannot be helped? We have to sacrifice, compromise our working ethics, our working skills to try and save the nation, but we cannot cope. You'd imagine how many doctors now are on sleeping medication, are on depression tablets, just trying to help, but the government not hearing our plea, not hearing our things. At some stage, we say, maybe if the minister could contract the disease, or maybe if the president, or maybe if one of the parliamentarians, they will understand what's going on the ground. They will understand the wards which are full, the nurses which are there being sick every day. For one doctor, you have 5 nurses. One doctor dies, you must know it's 5 nurses who dies. We don't have the luxury of health workers in the country. By the time that the dust settles, God knows that we won't be having any health workers in the country. That's a reality. So we need PPEs as soon as yesterday.
That's
and all those people who have.
That's a very scary picture.
Yes,
that's a very scary picture that you're painting. And every day we hear reports of donations of PPE, allocations of PPE. Are you saying this is not sufficient? Or is there another conversation in terms of the corruption story that's currently unfolding in South Africa?
All I can tell is that the corruption is deep. The corruption is deep. You can go to any clinic now. You won't find the sisters having full PPE gears. Every day we're in contact of infection. Every minute, every second. The hospitals are filling up. If they're saying we have not reached 70% capacity of our hospital, it's a lie. We have reached those capacity. Patients are lying in emergency rooms, waiting for rooms waiting to be taken to wards. And those patients dies in corridors. And the nurses and the doctors get infected from all those people without any PPE. You are forced to work with one mask, which is supposed to last for 3 hours, for the whole day or for 2 days, using the same mask. We have resorted to buying our own mask.
Yeah.
You know, I'll show you. I'm in the car. I'll show you. I've got my own bag of masks. I keep my own box. This is my box that I keep of masks in the car that I bought myself, so that I should be safe. I should at least in my environment be safe. But people are cruel. They've seen an opportunity in making money with our lives. And all those doctors who have passed on, people want to say they're heroes.
Yeah.
Those doctors were murdered.
Tell me something.
The nurses were murdered. And
within Samatu and
yes.
Within Samatu and in the medical fraternity, what is the conversation that's taking place right now about the sudden springing up of companies that provide medical supplies that didn't exist before the COVID-19 outbreak?
We actually said those companies should be vetted because none of them understand the medical implications of what they're bringing to us. They don't understand the importance of having quality things, you know, things which have to be certified, things that not only SAB, they'll tell you SABS has approved them. You need the medical health to approve them. You need FDA, you need all these medical facilities to approve those things, to make sure that they've been investigated thoroughly. It's not about money, it's about people's health. It's about the greatest insurance that one cannot replace. Your health, it's one of the most important insurance. So those people are only looking at, I call them the Range Rover clan. They're just looking at buying new Range Rovers, buying new expensive house in estates. We want to live like that too. We want to drink those Moët and Veuves, have great parties too, but we don't have the luxury of that.
Yeah.
All we know, we have the passion and the compassion to save lives. But in that process, can we save life and can our lives be saved?
Dr. Bo, give us a sense.
That's all we're asking for.
Give us a sense of the most affected health facilities or clinics and hospitals, if you like, in terms of, we know that you said that Gauteng is affected, like 70% of clinics in Gauteng are affected. Give us a provincial picture of where are the worst situations, the hotspots, the clinics where there's absolutely no government support and the chances of health workers contracting the disease there are even higher.
Okay, I'll give you one. I'll start with Eastern Cape. Eastern Cape, there's no health system at all. Definitely nothing, where doctors are working and nurses are working in a hospital with no ventilation. One ward is used for diabetic patient. When the patient that exists, a COVID patient moves in without being fumigated. I'll give you a situation in George Mokari in Gauteng. Every ward has got about 4 nurses who are infected and doctors. You've got casualty doctors who are 9 who are currently infected and on sick leave. I'll give you Bara. The statistics are shocking. There's no staff. Number of deaths are increasing by day. And we can hide the statistics, say things are okay, things are all right. Every ward in that hospital has got about 6 nurses who are sick, who are on sick leave. You've got matrons or in charge of wards who are on sick leave, meaning you've got wards which are not managed by any matron. They don't have any management. You've got specialists now when you're having emergency cases. The anesthetic specialists are the hardest hit. When they're supposed to go intubate those patients, sedate those patients to sleep for us to be doing all the operations, that's where most of them get those infections. You'd remember the first 2 doctors who died, those were anesthetist doctors. The Gauteng doctors recently that we have seen, we've got Jubilee Hospital, which is in trouble too, in Hammanskraal. There's trouble, there's no PPEs. It's a sad picture. I can quote and I can go, the list is long. You know, we have seen in Western Cape what happened. It's sad when we think the mortuaries are making money, they're dying too. It's no longer about money, but it's about people's life.
So to whose benefit is this misrepresentation of numbers and of the situation on the ground, how grave the situation is?
There are two facts there in there. It's either the reports are not reaching where they're supposed to reach on time, or whoever is supposed to be reporting is on sick leave, is sick too.
Yeah.
That's the reality of the point, that the statistics is sitting on somebody's table who's not on duty, who's sick, or who has passed on, that we have to employ a new person to take over that position.
Tell us about Samatu's interaction with government. We know that it was a bit uncertain in the past 2 years in terms of Samatu being official. But have you interacted with government, with the Department of Health, and what has been the result of those interactions?
We have requested a meeting. That was last month. We got a response on the 18th of July that they've responded, that they've acknowledged that they've received a letter, that we'll have a meeting with them. Even today, we're still waiting for that response, the date for the meeting. No one wants to take responsibility at this stage. That's why we say government is not taking the health workers serious. They don't see this as a reality on the ground, that by the time this settles, we won't be having any health workers, we won't be having doctors or anyone else.
How come?
So we don't know why they're not giving us meetings or dates of meetings, but only God knows. They know what they're fearing, because we'll be hitting them with statistics, showing them the reality on the ground, that everyone is making money out of us and they're not taking serious, they're not taking any stance against those people.
It's a bit bizarre, though, that Samatu wouldn't be part of the government COVID-19 response. Why is it that you're left out of the loop?
Okay, the one thing that we can say, I think probably there was a confusion of Sama and Samatu. That could be the confusion, that they're still saying Sama must come sit in as representing the public workers.
The health workers.
But Sama is not representing there's public sector health workers and the private sector health workers. So Samatu is representing the doctors who are working in hospitals, employed doctors, in hospitals, in private hospitals, but employed, they should be employed. Those are trade union doctors. And Sama, it's the non-profit organization. But we have separated from last year, November. The court order was there. The court was given. The court order was given last year, November. That we finally separated. At the labor court. That we finally separated the Samatu, the Sama. But Sama is still taking opportunities at some places where they're not supposed to be representing the public sector workers. So that could be the confusion there. But it does not make an excuse to the government, because Department of Health have been served with documents from the Labor Court and from the Register of Labor, and with Section 110 of who are the leaders of the trade union, who they should be communicating with. But when we write letters, they don't respond on time. That's why we're asking ourselves, are they ignoring us purposely because they know what's happening on the ground?
So we're asking our viewers today...
And they continue being socialite, saying everything it's fine, while everything is not fine on the ground. Or they're worried that will expose them, that's something else.
So we're asking our viewers today what more needs to be done to ensure that we stem this growing increase in the infection of healthcare workers by COVID-19. What do you think should be done?
We need proper
if you were given a chance to speak to government.
Listen, it's simple. It's not a complicated story. We need proper PPEs. We need full gears of PPEs. We need institution to be, to be ready, to be prepared that this is how we're going to do. Infection control must take over. The nurses, the doctors who are in charge of infection control, maybe they should be sent for further training, but they are thoroughly trained. Those are specialists in that department. So as simple as it is, PPEs should be delivered, and when a proper environment should be set for health workers. And two, if it means health workers should be quarantined somewhere, let us be given, like the Chinese, those kids, students coming from China, they were given a proper place to quarantine. Let us be given areas where we can stay or sleep to protect our families from that. That's all we're asking for. PPEs, nothing more. Safe working environment.
Let me ask you to hold on for a bit.
Lastly,
We're still going to continue the conversation. I'm just going to ask you to hold on for a bit as we look at some of the Twitter responses we've gotten this morning. Can we look at some of those? All right, Ayanda says, morning Desiree, government must make sure PPEs are the first priority for health workers, must be available, that's all. Well, that's exactly the same as Dr. Paul was saying. So Nobile Spidey is saying more recruitment of staff and buying more PPEs that will last the facilities months. Khuzo says healthcare workers need to be given enough PPEs. The government must prioritize them first because they are the ones who are mostly vulnerable as they deal directly with COVID-19 patients. All right, let's just wrap up this conversation with Dr. Poe. Dr. Poe, let me just ask you, as a medical practitioner, how has doing your work in the midst of this pandemic, how has that changed how you do your work?
It has changed in so many ways. One, it affects one psychologically. You need to prep yourself every morning, stop crying, be brave, go to work, you know, you'll make it. You'll take a plastic, you'll cover your face so that you should not get that infection. You want to give the smile to that mama. You're trying so hard, but you're not doing the best that you usually do at work. It has impacted so much. It impacts in-service delivery, how best you should deliver that service. It impacts on your fear, how best you should still deliver that. It's a difficult time. It's very, very difficult time that it makes one. People will say we are hostile. We are not hostile. We are scared. We are feared. We are in fears. You know, we are in tears every day. The reason we are saying all those PPE pioneers, they should be charged with homicide. They have killed the health workers. They have killed the people, the society members.
And as we give you condolences for all your colleagues who have succumbed to this outbreak, we thank you very much for talking to us this morning.
Thank you so much.
Dr. Poe there.